Elizabeth Voss, and I'm doing my head-to-toe assessment for 612 Maryville University. This is where he volunteered to help. Before coming in, we would get a full set of vitals, get height and weight. We would use the Romberg test to check his near vision and the Scowen to check his far, and that assesses cranial nerve 2. We would also have him empty his bladder and put on a gown. I would wash my hands, and as the patient's walking into the room, I would assess his gait and also his appearance, whether he's well kept, disheveled, and if he's well groomed. Then we would move on to assessing his head. We're going to check that the scalp is nice and normal cephalic, that there is no abnormal hair distribution, no noticeable scars, lesions, alopecia. We're going to palpate, see if there's any tenderness that we're not seeing underneath the hair or lumps or nodules. Okay, and then we're also going to palpate the facial bones to make sure those are nice and smooth. And while we're doing the head, we're going to go ahead and just do the frontal and the maxillary sinuses. And then we're also going to do the TMJ and have him open and close his jaws to see if there's any popping or pain with that. Okay, and everything looks good there. So now we're going to move on to the eyes. We're just going to take a look at the general appearance, make sure they're nice and symmetric, that his eyelashes are pointing outward, that his hair is equally distributed evenly, that he has no crusting or abnormal drainage that we've noticed. And then we're also going to look at his conjunctiva, make sure they're nice and pink and moist, and his sclera is white and no jaundice. We're going to have him check cranial nerve 5, and we're going to do the cotton test here. So close your eyes and tell me where I'm touching.
Forehead, left cheek, right cheek, chin.
Okay, and I also need you to scrunch your forehead, and just shrink your forehead. That was your eyes.
I can't do both at once.
Okay. So that is just checking the cranial nerve 5. So then we're also going to do the cardinal fields of gaze. This just checks to make sure that there is no nystagmus or anything like that, and it is checking cranial nerve 3, 4, and 6. Okay, I'm going to follow my pin right here. And again, we're making sure that there's no jerking or deviation in the eyes. Okay. We're also going to be checking the cover test, and this helps us to make sure that there is also no deviation in the eyes. So if you can go ahead and take a look at the wall back there, and cover one eye, and then uncover, and cover one eye. Okay. And then we're also going to do pleura. So we're going to check that the pupils are equal around and reactive to light, and also accommodation. So we're going to do direct, and then we're going to do consensual. So we're making sure that both pupils are responding. Direct and consensual. Okay. Now, we're also going to do the accommodation. I'm going to go ahead and just watch my pin light here. Okay, very good. Now that we're done with the eyes, we're going to move on to the ears. For the ears, we're going to just take a look at the general appearance, make sure that it's nice and symmetric on the head. There is no abnormal drainage, any lesions. We're going to look behind the ears, make sure there's no abscess or cyst of any sort. We're going to palpate the auricle. Both ears here. Make sure there's no pain. And we're going to grab the otoscope. And we're going to look into the eardrum to see if the tympanic membrane is nice, gray, and pearly, and that there's no excessive earwax, redness, or drainage. Okay. I'm going to go behind the patient. I'm going to whisper a word and check that the patient can hear me properly. Go ahead and cover one ear. Orange.
Orange.
And cover the other.
Blue.
Okay. The other thing to assess that the patient can hear properly is the Weber and the Romberg test, or the Weber and the Rene test. Sorry. The Rene will put on the top of the behind his ear on the mastoid bone, and that helps us to see if he can hear on the bone conduction and air conduction. So whenever I put this on your bone, just raise your hand when you can't hear any longer, and then when I move it, do the same. we're going to move and do that to the other side. Okay, very good. And then we're going to do the Weber. We're going to put that on the top of the brain, top of the head here, and see if you can hear it bilaterally in both ears. Can you hear it equally?
Yes.
Okay, very good. So that is it with the ears. We could do a smell test if I had like some coffee or some sort, and that would check the cranial nerve 1. We're just gonna look at the nose, make sure that there's no abnormalities, any sores, lesions, excessive drainage that we can see. We're gonna kind of look underneath here and see it at the septum. Make sure there's no deviated septum. We're gonna look at the turbinates, make sure that there's no polyps of any sort, and we're also going to check the patency of the nose. So if you can hold one nostril and then breathe, and the other nostril. Sounds like you got a little cold. And so now we're going to move on to the mouth. For the mouth, we want to take a look at the lips first. We want to make sure that his lips are nice and pink and moist, that they're nice and full, that there's no fissures, cracks. We're going to go ahead and have him smile. We're going to check his teeth. We're going to make sure that his teeth aren't chipped, cracked. We're also going to take a look at his gums. So if you can smile real big here, we're making sure that there's no bleeding. And then we're going to have the patient say, ah, and stick out his tongue. And when he's sticking out his tongue, we want to make sure that his uvula is raising with his soft palate, because that assesses cranial nerves 9 and 10. While I'm in here, I'm going to be looking at the soft palate, the hard palate, that his tonsils are not swollen or enlarged, that his uvula is midline. We're looking at his buccal mucosa that's nice and moist. We also want to make sure that we look at the tongue, make sure that it's nice, pink, and moist, that there's no abnormalities, and also underneath the tongue. We want to check. We're also checking the pillars in the back, as well as the oral pharynx. For the mouth as well, we're also going to check cranial nerves 12 and 7 by having him smile and clenching his teeth. And stick out your tongue. Okay, very good. And now we can move on to the neck. So we're going to first start with range of motion. He's going to have his turn his head side to side and then back and forth like this. Okay, and now you're just going to check the resistance and the other side. Okay, back and forward. Okay, very good. So his neck muscles are nice and strong. We're going to just kind of assess to see if there's any just jugular vein distension of any sort. We're going to see that the trachea is nice and midline. Then we're going to start palpating. We're going to palpate the trachea and the thyroid. Make sure we don't feel any abnormal masses of any sort. We're going to go behind the patient to have them swallow while I feel the thyroid. Go ahead and swallow. And one more. Okay. All right, and then we're going to palpate the carotids. One at a time. Okay. And then we're also going to oscillate the thyroid gland and the carotids. Take your breath and hold. Take a breath and hold. And we're doing that to hear if we hear any thrills or any abnormalities. So from the neck, we're going to move on to the lymph nodes. There's quite a few lymph nodes. So we want to assess the preauricle, the postauricle, the occipital, in the back of the head here, the tonsillar, submantle and submandible, the anterior cervical, which is also like the superficial cervical, and then we're going to do the deep cervical, so we got to get a little deeper, and also the posterior cervical. We're also going to check the infraclavicular and the subclavicular. And then also the axillary underneath the arms here. So once we assess all the nodes and make sure that we don't feel any abnormalities or that there's any swelling or whatnot of that, we're going to move on to the extremities. So we're going to look at both arms and legs. For both arms and legs, we're assessing the muscle tone, the hair distribution, for any scars. Coloring, we want them to be pink and warm, where we don't want dryness, excessive moisture. We're checking his fingernail beds, make sure that those are nice and good. And we're also checking capillary refill, for them to be less than 3 seconds in both the fingers and the toes. And we're also checking for clubbing. We're also going to check pulses. So we're checking the brachial on both arms, the radial on both arms, the popliteal behind the knee, the posterior tibial on the back of the inner ankle, and the dorsal medialis on the top of the foot. Okay. And we're also going to check arm muscle strength. So we're going to put your arms out for me, and push up against me, and push down, and to the front, up against, and down. Okay. And so this patient doesn't have any edema and all that, so we want to make sure that there's any abnormalities. From there, we're going to move on to the back. Have the patient turn. Oh, I forgot the reflexes. So we're going to do brachial. We're going to do the knees, and we want to pick a table that's taller so he can kick out, and also his Achilles and the inner ankle. Okay. So if you want to turn a little bit so we can see your back. Very good. Okay, so for the back, we're going to just kind of assess what we're looking at. We want to make sure that the patient's not in any visual distress, that they're not having any heaving, any like pulling on one side, respiratory rate, all that. So we're going to start with just palpating. We're just going to kind of feel for him to breathe. I'm going to take a big breath. So we're just checking for chest expansion, that it's equal on both sides. We're also going to have him do tactile firmness, so we're going to have him say 99.
99, 99, 99.
Okay. We want to make sure those are both equal on both sides. And we're going to then go from there. We're going to percuss. And we want to do both lungs here. We want to hear resonance. We don't want to hear hyper or tympanic or dull. Those could be signs of respiratory distress or illness or disease. So we're also going to find the costovertebral angle, and we're going to palpate those. Make sure there's no pain or tenderness. And we're also going to find the diaphragmatic excursion on both the right and left side. The normal is 3 to 6 centimeters. So we're going to have the patient take a deep breath and hold. Okay, and so I would mark there, and then you can release. And then take a normal breath. And then on the exhale, hold. Okay. So this is about right here. So we would do that on both sides, and like I said, it would be equal on both sides, 3 to 6 centimeters. So from there, we can have him turn back. We're going to go ahead and go to the chest. Oh, you know what? I forgot to listen to his back. Big breath. Big breath. All right. Go ahead and turn. So So we're going to do the same with the front. We're going to kind of just watch his respiratory rate, watch his chest expansion, make sure that he doesn't have any heaving or pulsations. So I'm going to fill the precordium here. And we're also going to do the tactile firmness in the front. 99.
99.
Okay. We're going to also percuss laterally and anterior. So go ahead and lift your arm here for me. Okay, and the other side. Okay. And then we're going to percuss down the lung field here. All right, so once we're done with that, we're going to listen to his lung field here. Big breath. Yeah. All right, so from there we're going to listen to his heart. We want to make sure we listen to the aortic, the pulmonic, the Erb's point, the mitral, and the tricuspid. And I also need to palpate his apical pulse right here. Pretty normal. All right, so once we're done with the chest, we're going to move on to the abdomen. You want to lay down for me? Okay. So for the abdomen, we're going to do a first overall inspection. Just going to check that there's no lesions, any bulging that we can see just looking. We're also going to watch the aorta. Make sure that there's no pulsations. We're going to then listen before we do any palpation. So we're going to listen to the 4 quadrants. We can listen up to 5 minutes to hear vowel sounds. We're also going to listen to the aortic, the iliac, the renal, and the femoral arteries. So once we're done with oscillation, we're going to start palpation. So we want to find the liver border, and we also want to, we're going to do percussion. So we want to percuss first before the palpation to find the dullness versus tympanic. We want dullness over the liver or any solid dense organs. We want tympanic over any fluid-filled organs. And the percussion is the way we're going to find the liver border. So the liver over here on the right side, we're going to move our way down. And we're going to mark right there. And we're going to move our way up. And we're going to mark, and like I said, the normal is 6 to 12 centimeters. So then once we're done with the percussion, we're going to start the palpation. So we're going to try to palpate the liver or the spleen. Okay. And we don't want to fill a spleen in a normal patient. And then we're also going to try to palpate the liver border. And we're just making sure that there's no enlarged liver. Okay. And then we're going to do light palpation throughout the rest of the abdomen. And then we're going to do deeper if the patient tolerates that. make sure there's no rebound tenderness or any bumps or nodules that we didn't see on visualization. We're also going to palpate the aorta, and we're going to try to palpate the kidneys. We're going to have the patient take a breath and hold, and then kind of push down, and the same on this side. Okay. All right, so once we're done with the abdomen, we have the patient sit up. And during all that, we're also palpating the abdominal muscles to make sure that there's no abnormalities or any weak spots that could develop hernias. So then we're going to have the patient stand. And we're just assessing, have them bend a little bit at the waist there, and we're just assessing that the thoracic and the cervical spine doesn't have any curvatures or any abnormalities with the chest expansion. All right, and that conducts my head to toe assessment.